Good afternoon, everyone, and thanks for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Shahab. Joining us over the line in Saskatoon is SHA CEO Scott Livingstone. Both the Premier and Dr. Shahab will have opening remarks, followed by time for questions. Premier?
Well, thank you. Good afternoon, everyone. Today we are reporting 6 new cases, as well as 5 additional recoveries. There are now 88 active cases in Saskatchewan. Most of the active cases continue to be associated with 2 localized outbreaks in the northwest and the southwest portions of our province. The Saskatchewan Health Authority is following up on a new case involving an individual who tested positive after working as a server at a bar in Emma Lake this past weekend. Anyone who was at the Sunnyside Bar last Friday, Saturday, or Sunday afternoon should self-monitor. And if any symptoms do develop, self-isolate immediately and call 811. While localized outbreaks will continue to occur, the number of active cases in our province remains very low. With just 6 active cases in the North region, 4 in the Saskatoon region, no active cases in Regina and the central regions of this province. So today I am very happy to announce that all of the remaining reopening dates in Phase 4 of the Re-Open Saskatchewan plan. As always, all of the businesses, facilities, and activities that can reopen have guidelines they will need to follow to keep their staff and to keep their customers safe. All of those guidelines are in the updated Re-Open Saskatchewan plan, which can be found on the government website. This Monday, July the 6th, all indoor recreational facilities, including rinks, indoor swimming pools, and bowling alleys, can reopen. All indoor sports and activities can begin. Also this Monday, July the 6th, we are removing the 50% capacity limit on restaurants and bars. While there will be no specific percentage occupancy cap, bars and restaurants will still need to maintain an occupancy level that maintains safe physical distancing for their customers and for their staff. That same day, bars and restaurants can reopen their VLT machines and recreational areas such as pool tables, video games, and darts. On Thursday, July the 9th, bingo halls and casinos can reopen. This includes both SIGA-run casinos and the 2 Sask Gaming casinos, Casinos Regina and Moose Jaw. Starting Thursday, July 16th, restaurants and bars can have live entertainment. And also beginning on July 16th, a number of remaining outdoor sports activities can start with a limited number of spectators. This includes things like rodeos, barrel racing, and stock car racing. I should note that the guidelines for these activities are still being developed, and they should be available in the Re-Open Saskatchewan plan very soon. With these reopenings, virtually every kind of business, facility, service, and activity in this province are now reopened. Again, I want to thank everyone in Saskatchewan for everything that you have done to control the spread of COVID-19. It's appreciated. I want to thank you for your patience as well as we moved as quickly as possible, but also as safely as possible through the reopening phases. And I want to encourage everyone to continue all of the good practices that have gotten us this far. That is how we will continue to control the spread of COVID-19, control the spread of this virus so that everyone can remain open. With case numbers still rising in many other parts of the world, we know that COVID-19 has not disappeared. It can spread very quickly if we let our guard down even for a moment. And that's why we still have to remain so careful, and why we will need to move forward very cautiously with Phase 5, which is lifting the restrictions on large gatherings. We know that in Saskatchewan and elsewhere, large gatherings have resulted in some of the largest outbreaks. So we will need to be very cautious in relaxing those restrictions. I also want to mention that our government and the Saskatchewan Health Authority are working on new guidelines to provide a greater opportunity to visit your loved ones in long-term care and who may be in the hospital. We still have to be very careful in those facilities, as that is where some of the most dangerous outbreaks in our nation and around the world have occurred. So we are working to find the right balance that will keep everyone safe, while recognizing how critically important it is for hospital patients and our seniors in our long-term care homes to be able to see members of their family. And we expect an announcement on this later this week. Finally, I want to take the opportunity to wish everyone in the province of Saskatchewan a very happy Canada Day. Canada Day is going to be very different this year, with many of the celebrations and activities scaled down or canceled. But you can still get together with a few of your family and friends at a park or at a lake or on a beach. You can celebrate Canada Day by enjoying the great Saskatchewan summer that we have. Happy Canada Day, everyone. Dr. Shahab?
Thank you. So I think all I'd like to say is that we all know the routine or the drill now in terms of maintaining physical distancing as we go out and about, and enjoy a lot of the activities that are now going to be opening up this week and over the next 2 weeks as well. And the second thing is that the public service announcement about notifying people who were at a certain place on a certain time to self-monitor and seek testing if they become symptomatic, I think is a good message that should, we should all remember that all of us should have a good idea of what we've been doing over the last 2 weeks, so that if we do see a public service announcement or otherwise have any concerns or ourselves have any symptoms, we can seek testing and also provide a good summary of all the activities we've been involved in over the last 2 weeks, because that will help to make sure that people who may have been exposed are contacted in a timely way and isolated, and that will help for us to continue to investigate cases and clusters which will arise every now and then, but to make sure that they don't expand any further than they need to beyond a certain number of people who, occasionally getting exposed in some of the settings which are now open. But generally, if we do follow the basic principles of not going out and about if you're unwell, seeking testing at the first sign of symptoms, maintaining the physical distance where it's possible, using a reusable mask where appropriate, and otherwise complying with all the guidelines, we certainly hope to see very few cases and outbreaks overall. Thank you.
Thank you, Premier. Thank you, Doctor. I will take our first question from the room. Murray?
Can you just clarify, either Dr. Shahab or the Premier, please, what this means in terms of the old stage 4 openings? Does this include everything in what was the old stage 4 now, which would be 100% daycare, which would be the remaining surgeries, I guess maybe what's not open, but can you just clarify what this means in terms of where we're at in that sense?
So this does include, Dr. Shahab, I'll start and you can clarify any of the errors that I make in my comments. This does include the opportunity to open in some capacity all of the stage 4 businesses and services that were in there. Now, that doesn't mean to 100% capacity. In casinos, for example, each one will have their own cap and will be expected to ensure there's good physical distancing opportunities and requirements throughout the facility. In the case of daycares, they remain where they have been for some time at 15, a maximum of 15 per room per caregiver. And in addition to that, on the daycare capacity side, we have still, I believe at my last check, it may have changed slightly, as it was a couple of days ago, about 50% of our capacity that remains in our school-based daycares that we kept open in the initial stages for our essential workers, and then expanded that to anyone that may need some short-term daycare services. So there'll be more to say on the further expansion of daycares to a larger capacity. Right now, they are at 15 per caregiver, as they have been for some time now. But everything else that was included in the original stage 4 reopening now has the ability to reopen in some way, shape, or form. Anything to add to that, Doctor?
Thanks. So I'll just add that the only thing that remains once phase 4 is done is limiting on the size of public gatherings. So how large can they safely get, in what settings, and what context? So that'll be an ongoing area of kind of input and then recommendations going forward. But all the other things that I mentioned earlier, they have to remain in place as long as the pandemic is here in Canada, in Saskatchewan, and globally. So those are all the things that we need to continue to practice, physical distancing, hand washing, not going out if you're sick. So those are the things that will continue under phase 5 for as long as there's a pandemic. But then how large of a gathering can we safely have, and what kind of context? I think things that will continue to be looked at July onwards.
I would just add to that, Anne-Marie, you'll see some refinement of some of the health recommendations and the Re-Open Saskatchewan recommendations that are there as we find our way through this. But for all intents and purposes, everything up into including stage 4 is able to open in some capacity now. You'll also see some refinement later this week on some of our visitation guidelines in our healthcare facilities and our long-term care facilities. So essentially, the largest step that we would have and would have to consider is those large public gatherings. And there may be some tools that will be coming in the days and weeks ahead, not just to Saskatchewan, but across Canada. For example, tools like the access to a contact tracing app, for example, that may be part of that discussion when we're able to get there, that we just don't have all of those tools right now to, let's say, go have a Saskatchewan Rough Rider game or anything like that. So we've came a long way due to the effort of so many in this province. Our numbers remain constant and fairly positive, and so a little bit more of a path to travel here. But for all intents and purposes, until such time that we're dealing with this pandemic, we are going to have some fairly a fairly comprehensive document in the Re-Open Saskatchewan plan that will guide the safety of our business environment, of our community services, of our recreational services.
Follow-up, Mary?
Well, not to dwell on this, but to absolutely dwell on this. The mask use issue, why would you not, at this particular stage, offer something a little bit maybe more strident than what I think is a firm recommendation that you should wear them in public spaces if we're going to be as bold as we now seem to be in terms of some of the public openings?
So I'll just start, and again, Doctor, right now I have always said that if you are comfortable and feel more comfortable wearing a mask, in particular if you're not able to abide by the physical distancing standards, you should do so. You should do so, and we should all be supportive of individuals that choose to do so. It does help. A mask usage, as far as it being mandatory, may be a conversation that we may have to have in certain areas of the province if we should have a localized outbreak. We haven't had to yet, but for instance, that would be something that I think we would want to have a very active discussion about prior to having to take more drastic action, like closing sectors of the community, playgrounds, recreational activities, and ultimately but potentially a conversation in localized areas around businesses having to close for a short period of time. We don't want to get there. So there may be an opportunity in those localized areas to have a mandatory mask, a temporary mandatory mask order put in place. We're seeing that conversation happen right now in Ontario in a couple of municipalities, I believe Toronto and one or two other places. But Dr. Shahab, I think you were just on a national call with your colleagues, and you might have more to add on the regionality or the effectiveness of masks and what your opinions are, which I hope don't differ too far from mine.
Yeah, so thank you very much. So I think the first step is all of us should have a mask on our person that we can put on when required. And all this doesn't have to be color coordinated, as this one is not. And so that's the first thing. The second is, like we mentioned, the pandemic is going to go on for weeks to months, and we need to pace ourselves. So if I go about my daily work and business, I maybe come across 2 or 3 occasions in a day where I have to put my mask on because I can't guarantee 2 meter separation. So I'll put that on, and once or twice or 3 times a day for maybe half an hour, 1 hour, or longer, and then I'll go home and wash that. So I think that's what we all need to train ourselves. Have a mask on hand, reusable, washable, more than one per person in the household that you can use as and when required. And certainly I've said before that if you're out and about walking, enjoying the great outdoors, there's no one even within 5 meters who's not part of your household. There's little value in using a mask. But certainly if you're in a setting where you can't reliably maintain physical distancing, maybe it's a retail location where there's a bit of a rush. And even there, the best principle is maintain that 2 meter distance. But if you feel you won't be able to, it's a good practice to put a mask on. Similarly, if you're visiting your healthcare provider or in certain other settings for personal care services, using a reusable mask when getting a haircut is consideration for others and for the staff as well, even though they also will have a mask or other tools to protect themselves. So I think we all need to just get into the habit of using a mask, just like we are in the habit of now maintaining that 2-meter distance as much as we can. And certainly in the fall, on the one hand, there'll have to be more mask use as we move indoors. But on the other hand, we also need to understand that in the school or daycare setting, we will not be recommending masks for children or in a class because, really think that the evidence shows that that's not very useful. You can't really maintain the 2-meter separation or wear a mask in a classroom with elementary school children, for example. And there we want to promote the principle of cohorts. So we already have the principle of, make a virtual cohort of 15 people. But as school starts, your class is your cohort, your teacher and children, so that if there is, in the rare event, a case, the risk of transmission is low anyways in children, but at least it's a defined cohort, and the fact that there won't be large assemblies or other large events, even in the school setting, will be another added layer of protection in those settings as well.
I'm actually shopping for a new mask, one that would have the Saskatchewan Rough Riders logo on it, as I just received a mask from Premier Legault with the Montreal Canadiens logo on it, of which I will have to provide to one of my nephews that for some reasons is a fan of the Habs. But I will very quickly find a Saskatchewan Rough Riders mask and send it to Premier Legault, and he can wear that proudly.
We'll take our next question from the phone line.
Thank you. I'm just wondering if the positive case in MLA gives the government and health officials pause about removing the seating cap within restaurants starting next week.
Want to answer that?
Yeah. So I think the principles of the initial 50% capacity was to allow restaurants to make their business plan, and that really allowed virtually all bars and restaurants to reopen in a safe manner, and they could scope out, how they will serve food and how customers will be seated so that they're physically distant. And then several restaurants said that we are confident that we can increase our capacity while still maintaining that physical separation between groups of 6, for example, and maintaining that physical separation between servers and staff who work there and customers. So from that perspective, I think relaxing those guidelines is appropriate now. Secondly, other activities within bars and restaurants like pool and other things will be allowed. But again, we have to understand that if you go there as a group, you're already sitting at one table and you choose to play pool together, that's fine. And then there'll probably be some cleaning and sanitation of queues and so forth. And we just need to understand that we're choosing to enjoy this recreational activity with some maybe increase in risk as a group. We're choosing to enjoy that. And if there is a case for a transmission, I think we expect to see that. We hope that with these guidelines and regulations, we won't see multiple and expanding chains of transmission. And of course, getting tested at any sign of symptoms helps public health to then connect and be engaged and address any expanding chains of transmission. But I think on the one hand, we are confident that with these guidelines, we can start enjoying the things that we used to enjoy, but at the same time, expect to see the occasional case of cluster.
I would just add to that, this is an example of where I've been up here many times and thank people in the province for adhering to the public health measures that are in place, the physical distancing, the washing your hands, and the measures that businesses have put in place. And anecdotally, I have heard that this particular business at the Sunnyside Bar had great measures in place to protect not only their staff but also to protect the customers. And it's our true hope that is the case. The second piece that we have to ask the people of the province to do is when we do have these localized outbreaks, and we will have them over the course of the next number of months, that in this instance, if you were in that establishment this weekend, that you self-monitor immediately. Maybe start to limit the number of people that you unnecessarily are having contact with over the course of the next week or two, and start to self-monitor, and at the first sign of symptoms that you dial 811 and request a test. This is the other side of ensuring that we're able to, I'd first identify where these outbreaks are, but two, to contain them to the smallest number of people possible so that we don't have a province-wide outbreak or province-wide pandemic. It's important for us to continue with adhering to the public health orders, but also when we are in a situation where we could have been exposed to this virus, that we take the necessary action to ensure that we keep the outbreaks as localized as possible. And for that, I thank Saskatchewan people, and I thank them in advance for, in this case, self-monitoring for the next couple of weeks.
Follow-up, Guy?
Yeah, thank you. The province and its health apparatus has taken a bit of heat from some quarters when it comes to public health alerts or advisories that have specifically named either a subset of the population, such as the Hutterite colonies, or a specific business, such as Sunnyside Beach Bar in Emma Lake, where either a case or an outbreak has occurred. I'm wondering if you can talk about, from the perspective of trying to curb the spread of this virus, why it is important from the province's perspective to be as specific as possible in those alerts.
Yeah, so I can walk through the principles of public service announcements when investigating a situation where others could have been exposed. So if 6 people work in an office and one person showed up to work unwell, public health investigates. There's no customers coming in and out. It's just those 6 people. Ideally, they've been maintaining the 2-meter separation anyways. So there's little risk to the other co-workers, but they're all informed to self-monitor for 2 weeks. If someone was a close contact, he may be asked to stay home for 2 weeks. But generally, everyone has been accounted for. There's no need to do any public communication because it is a work setting, but it is a closed work setting. But where you have a setting like a restaurant or a bar where customers may have come and gone, the only way to inform customers is through a public service announcement. So that's why we all need to have a rough idea of where we've been in the last 2 weeks and pay attention to these public service announcements. So if we were in that location on that date, and there have been a few in the past around bars or a grocery store, that where there's a need to inform the public is informed, and then the direction really is to self-monitor, maybe minimize your contacts for the next couple of weeks a bit, and at the first sign of symptoms or any other concerns, think about getting tested.
I would add to that as well. There's a balance here, and I think public health and Dr. Shahab, led by Dr. Shahab, has worked very hard at striking this balance. There's been conversations in this room over the course of the last number of months where we haven't been specific enough with where these cases actually are on a community by community level, and Dr. Shahab has come to an area much like other provinces where we report the broader cases on a regional basis, but where there is an instance where we need to inform people, like, for example, this last weekend, if you were in this establishment that had taken necessary precautions to diminish the risk, but if you're in this establishment, you need to know so that you can self-monitor over the course of the next 2 weeks, and if you do develop symptoms, that you're able to dial 811 and ensure that you can tell them where you were, and we would be able then to trace any potential spread of this virus. So there has been pressure at times to be more specific with the general numbers that we're reporting, and now I think there's a conversation around with these public service announcements. Are they too specific with the information that is given? And I would just share some of my own accolades with Doc. Take the proper precautions, take the proper steps to ensure that we are doing everything that we can to stop the spread of COVID-19. And I think the success of that bears in the numbers here in the province. Again, I reiterate, we are 76% below the national average on the infection rate. We're 95% below the national average when it comes to fatalities. These are very good numbers. They're very good numbers because Saskatchewan people have and continue to follow the public health advice. But the public health advice has also been very sound throughout this. And for that, I say thank you again to the people of the province. But I also say thank you to Dr. Shahab and his team, as he has worked very hard to strike what I think has been an effective balance.
We'll take our next question from the room, staff.
Yeah, it's good to hear. Do you wear a mask?
I have this Montreal Canadiens mask now, and I also have a number of disposable masks. And yes, I do wear a mask, not all the time, but for instance, when I go for a haircut, I've wore a mask in instances such as that.
Why, when we don't even have a vaccine or any kind of a treatment coming online in the foreseeable future, are you looking at the future of large gatherings? Like, how is restrictions on large gatherings, or how is large gatherings in any way something essential that you'd want to look at before there is some kind of a treatment online for COVID-19? Like, I can understand why you want more people in restaurants or to get haircuts, but I don't understand why you're even considering large gatherings.
I wouldn't say we're actively considering large gatherings, but we are looking at the tools that may be available today or could be available in the near future to potentially have that discussion around how you could safely have large gatherings with some efforts around physical distancing, with some contact tracing apps that are available. Why one would any government entity or any entity would want to look at large gatherings would be on request. And automatically we think of the Saskatchewan Roughriders, but because they're a gate-driven team, they generate their profits from the tickets that are sold at the gate, and they are an entity that has been in this province for 110 years. But there's also other entities as well. There's we have some of our junior football leagues. We have the Saskatchewan Junior Hockey League. We have the WHL, all gate-driven leagues that do need to have the opportunity to have people in the stands if they are going to survive financially. So we're not quite there yet, but I say that about the app is we don't quite have all of the tools at our disposal yet that may be available come around to this fall when those leagues might be interested in moving forward. So there's no guarantees that we would be able to find our way through that. But there is a reason to be looking at it. It would be on the request of the leagues and the communities that are hosting teams that play in these leagues.
Have the riders put a request in?
Not officially for this, although we have been in conversations with the riders, as I said earlier on, is there safe rules for play for those that are involved on the field, as well as not just the riders, but the CFL, as well as the minor leagues. And then the secondary conversation is if you can actually play the game safely with limiting your risk, would you be able to put people in the stands, and what would that look like? We haven't been to that second conversation with them at this point in time. You met with the riders as well, Doctor.
Yeah, so I'll maybe speak in two sections. One is that I have had one meeting with the riders, and of course their considerations are safety of players and teams and the staff who support sports, but then also looking at what's a feasible way for getting fans engaged, either through transmitting sports and not having fans in the stands, but of course what is a feasible way to have limited number of fans, and does it make sense to have a very restricted number of fans. The other thing I just want to talk about gatherings was that we have seen that most of the transmission events and large gatherings happen when people mingled. So even a gathering of 10 or 15 people and now 30 indoors or 30 outdoors, even there, if you're not part of the virtual household, there are some principles you should follow. The backyard barbecue, maintaining that physical distance, maintaining the caution around one person maybe serving the food or the food being plated. So it's not the size of the gathering, it's what's happening, what are you mingling? And then when you now go to see a show or a movie where there may be up to 150 people, but you're not mingling with everyone there. You are going into your assigned seating and maintaining that physical distance with others who are not part of your group, or even in a restaurant, you're not mingling with everyone. So I think we have to understand that it's not just the size of the gathering, it's how you are participating in an event, who are you potentially getting closer than 2 meters to, what are some of the kind of areas where there's multi-touch surfaces where we need to just make sure that we pay attention to hand hygiene, like using a washroom or going to a concession or purchasing a ticket, sanitizing or washing our hands after each such kind of proximity. And I think those are the principles that will guide us forward, not just the size of the gathering, but within our cohort, minimizing mingling outside of our group or cohort, and learning from events that happen, because we have to understand that there have been nationally reports of events that happen, transmission in a nail salon, for example, or other settings where we need to learn from them that some could be unavoidable because of it just happened, but some, we'll continue to need to learn from events to see, can we continue to improve the guidance that we have.
We'll take our next question on the phone line.
We have Ashley Martin with the Leader Post.
When will the recommendation against travel out of province be lifted?
So there is no recommendation against travel out of province. There was a recommendation that said that avoid non-essential travel, and even now, most provinces in Western Canada, for example, or even provinces in the Eastern Canada have no restrictions, and I understand in Atlantic Canada they are lifting those restrictions. But again, it speaks to what I just said about mingling, that in general the principles are, this summer stay closer to home. If you do decide to travel to another part within the province or another province, understand what's the situation there in terms of transmission risk. Are they open to receiving visitors from another province? Is there bookings available in a hotel or campsite? Know that beforehand. Travel in a way that don't travel, obviously, if you're unwell. Maintain, physical distancing, all the good things we do here in another province. Be aware of extra other considerations that may apply there that may be different from here. Have a plan that if you feel unwell, who will you call locally to seek testing? Be prepared if in the rare occasion you test positive for COVID to stay on for another 2 weeks. And I think those are things that we just need to plan out a bit. But otherwise, there's no restrictions as such. But the recommendation really is, enjoy the summers closer to home this year.
Follow up, Ashley?
Yes, another question, not related. Just considering the data that you shared last week, Dr. Shahab, where 22% of the people tested in Saskatchewan who tested positive were asymptomatic. I was just wondering if you could comment on that as basically society is, open as it can be until there's a vaccine. What does it mean if we have 1 in 5 people walking around potentially with COVID, but they don't ever show symptoms?
Yeah. So thank you for the question. So the 22% has been cited, 20 to 35% of people may be asymptomatic has been cited in the literature. And what we found that when we had our intense outbreaks, especially in the Northwest, public health was doing active case contact investigation and may test everyone in the household irrespective of symptoms. So that's how we found that especially if you're younger, you may be asymptomatic or have very mild symptoms and be positive for COVID. But in those situations, usually you clear the virus very quickly within a few days. And that is exactly why we say that even when we're out and about, we're not symptomatic. We shouldn't be out and about if we're symptomatic. But when we're out and about, even when we're not symptomatic, we have to maintain that 2-meter separation. We have to pay attention to hand hygiene, use a mask where we can't maintain that 2-meter separation. Our concerns about large gatherings, our concerns about mingling, exactly because of that, because not everyone who is infectious is always symptomatic or may have very mild symptoms. So that's exactly why we have to practice, all of us, those principles as we move forward.
Take our next question in the room, Murray.
Regardless of what we're trying to attempt to do in terms of border closures and such, what is the concern right now related to what's happening in the United States, how easily it might be transmitted back to Canada or elsewhere, given what seems to be a large outbreak, particularly in some of the major states in the U.S. where people from Canada are bound to have more contact right now. And what I guess what I'm getting at is what kind of fear or concern does that leave you with in terms of when the next wave outbreak happens in this province?
So maybe there's 3 parts to that question. One is that we obviously need to learn from other jurisdictions that either flatten the curve like some European countries and some countries in Southeast Asia and are seeing a resurgence, and understand why they're seeing it and what can we do better even as we reopen to prevent a surge happening, or if we do see one, how do we control it? So what lessons can we learn? Second is, I think in some jurisdictions it's a cautionary tale of reopening before you have flattened the curve. So that's not the situation in Saskatchewan, but certainly there were reasons why we went into lockdown and reasons why we reopened in a systematic way. And the third thing is, I think over time there will be more international travel. But again, currently the guidance on international travel is that it's not recommended, even though Europe announced that Europe is open for Canadians and others, and you still have to comply with the federal quarantine for 2 weeks. But over time, I think it'll just be something that, just like for travel interprovincially, we just need to be aware of where are we going, what's the situation in that country, what should I do if I get unwell, can I stay on for 2 weeks if I'm unwell to finish the quarantine in that other place, and what do I have to do when I come back. So I think those principles apply whether you're in Saskatchewan, whether you're traveling interprovincially, or in future as international travel opens up or is recommended. I think those principles will stay in place as long as there's a pandemic in the world. And obviously, different countries are at different stages of the curve. And this will continue till such time that there's a vaccine or it's run its course, which may be many months.
Can you then explain to Saskatchewan people why they should be less concerned about a full opening of bars and restaurants here compared with Florida or Texas, in light of Ashley's observation about how many people in this province do seem to be asymptomatic?
I think what I would like to say is that we need to be cautiously optimistic but not complacent. And I think there's a big difference between that. I think we can be cautiously optimistic that we are in a good place to reopen, but we certainly should not be complacent. And we know now from many Canadian jurisdictions that some gatherings that were not thought out well, certain other provinces, they've been gatherings where, or multiple gatherings that people went to where they had multiple chains of transmission. So I think even now, while we're cautiously optimistic, we can't be complacent. And unless you're part of a virtual household, you go to an allowed gathering of 10, 20, 30, we still have to practice those basic principles, I think.
To be clear, why are you confident that what has been happening in Texas and Florida after the reopenings there won't happen here in Saskatchewan, now that you are proceeding with the same level of 100% openings in bars and restaurants and such?
I think what I like to say that we are each other's peers who will hopefully exert some kind of a social pressure for all of us to behave as we should. Because I talked about, someone cuts into a queue, they're immediately reprimanded, and I'm not saying that we should maybe do that if someone isn't physically distancing, but I think in general people have complied, and I think that's what one would expect, that if you're going to a restaurant or bar, you would comply with those guidelines. And certainly, I think if people feel that the compliance is not happening, maybe they should not be there because it maybe not be a safe situation, and there's opportunities to cite concerns. There are email and call-in numbers to express your concerns. And I think we owe it as customers when we visit an establishment that business owners have gone to great lengths to make it a safe, enjoyable experience for everyone. And all of us need to behave in a way that everyone else feels safe and comfortable as well.
I would just add to that on Dr. Shahab's comments about being cautiously optimistic but not being complacent, and that's for the business owners, the restaurant owners, the bar owners, as well as the customers that are in those establishments. And Dr. Shahab is right. If you're not comfortable with the physical distancing measures that are in place, you should choose to support somewhere else where you are comfortable. But one of the differences between, and I've talked to some people in various states where we are having an increase in the numbers, is just that Re-Open Saskatchewan plan that has been developed under the careful guidance of Dr. Shahab's office and his staff, with all of the parameters that are in place around physical distancing, all the parameters that are in place around the sanitary services that need to be rendered in these facilities. And we're hopeful, as in the case in the most recent situation in Emma Lake, that the plexiglass and the wiping down of the Interact machine and the table will prove to limit the spread of this virus. And what otherwise, just a few months ago, was a very similar situation at a poker rally where there was quite a large outbreak from one individual there. So we're hopeful that these measures that are in place will prove to be helpful in Saskatchewan's case, and some of the states, I know at least, they're not in place.
We'll take our next question on the phone line.
We have Mark Smith with CTV.
Hi. Further to the question earlier about large gatherings, what's the province's appetite to be considered as a hub city for the CFL, and to what extent have there been discussions with the league about the possibility of that?
From the Premier's perspective, very large appetite to be a hub city and to host some CFL play here. But in saying that, it needs to be done in a safe manner, and it isn't a cheap undertaking. It isn't an easy undertaking, and it would take a fair amount of work, not only by our public health officer, Chief Public Health, Medical Health Officer and his team, but also by quite likely Canada's Chief Medical Public Health Officer. We know there is an ask in front of the federal government by the CFL for a couple of options, either a hub city option where we could have a modified season or no season at all. Listen, the CFL is a Canadian league, all Canadian teams. A certain degree of Canadian players is guaranteed to be on each of those teams. It is a league that we've been very proud of as being here from Saskatchewan, and most particularly proud of our Rough Riders, but also proud of the strength of the league over the last century, and would like to see it to continue. So we'd hope the federal government would look at the proposal that is in front of them, either for a hub city model, of which we would actively work with our Saskatchewan Rough Riders and the CFL on seeing if there is that potential. There may not be, but for certain, actively look at how we can regain then with a strong league next year. Anything to add to that, Doctor?
I think all I'd say is I agree with the Premier that I think it's quite a significant undertaking by the league, as well as other staff who have to accommodate teams in a cohort, cocooned manner. So I think there's lots of complexities there, and everyone needs to feel comfortable and confident that it's worthwhile doing that for this season.
We've seen this in some other leagues, and it's not without its struggles and challenges and setbacks.
Follow-up, Mark?
Yes, Dr. Shahab, earlier this month you stated a more detailed breakdown of where positive cases were in the province was coming. Is that still the plan? And if not, why was the decision made to stay with the 6 regions?
So as I showed in my briefing last week, our overall case numbers are distributed across 5 large geographies. And if you look at our total cases, active cases, hospitalization, deaths, if you look at those 5 geographies, it kind of shows that we've had most of our cases in the last 2 weeks, for example, in the Northwest and in the Southwest. So even there, it's very specific geographies that active cases have happened. And I think that's why, if you whatever geography you choose, that doesn't tell the whole story. So I think it is important to look at the information we have on our website, to look at where active cases have been over the last 2 weeks, which is really the active cases. The active cases show where cases have been over the last 2 weeks, and the total number of cases as well as hospitalization and deaths. I did give quite a detailed account of hospitalizations, both ICU and non-ICU, by age group and underlying risk factors that you can't do by geography, because the numbers thankfully are so low that it would not be appropriate to do that by geography. So we have to aggregate that at provincial level. And finally, when there's a public service announcement, that actually there's no use doing it for a wide geography. That has to be as specific as possible, like for the recent one yesterday, or when there's an outbreak where people within that geography need to be aware, like in the Maple Creek area or in the Northwest. It's appropriate to not just say there's an outbreak in the far north or in the south. You have to be even more specific than what the geographies allow. So I think we have to speak to the actual case numbers and the outbreaks, which currently have been very localized. But if things were to change, and if there was a broader area where there was some concern, we would have to speak to that broader area. So the geography concept is quite scalable. It can be a very localized issue, and we speak to that in a very localized fashion. Or it could be, a larger geography, and we will speak to that if that is the area of concern in future.
We'll take our next question on the phone line.
We have Laura Fominov from CKOM Saskatoon.
Dr. Shahab, there are now 106 unknown transmission cases in the province. I was just wondering what is accounting for that. Is that a shortfall regarding contact tracing, or is that a community transmission?
So a couple of things. One is that, in March, April, the bulk of our cases, around 150, were due to people traveling to Canada from international locations. And then we started seeing cases in people who had not traveled anywhere, but we did see about 60 to 80 cases and continue to see cases in people who are likely exposed in another province. So that's one thing, that if we can determine that exposure happened outside of Canada or in another province, that's useful for us to know where the exposure happened. And then when we have an exposure within the province, we obviously do a case content investigation. And in many cases, so in 60-70% of cases, we do find that most cases are either went to a large gathering or another event where there were other cases, and that sometimes takes many days to weeks to piece that together. And that's good to know, because at least you know where transmission happened. And then we also know that in many cases you can see second, third generation of transmission, usually in close contacts or close household contacts, and that's also good to know, because you know that this is the chain of transmission, and as long as close contacts, household or otherwise, can remain isolated for 14 days, that's how you break the chain of transmission. But having said that, we do know that COVID hasn't gone away, and there's always going to be some low level of transmission. So we will always see pop-up cases where we can't explain their exposure. So we try to get as much information we can about their 2 weeks, where they've been, and try to notify people with whom they may have had close contact. But we cannot find the exposure in every case, and that's exactly why there's no point putting pins on a map and saying there's a case here and the case here. But don't worry about all the communities in between, because anywhere in Saskatchewan you can have an exposure. The risk is low, but the risk is there, and that's why we have to maintain our good practices of physical distancing, hand washing, not going out if you're sick all the time.
Follow-up, Laura?
Yes, this has to do with vaccine development. So the province is, of course, developing, or Vito Intervac is developing a vaccine right now, but Saskatchewan is not taking part in any testing treatments or trials or options or anything like that. Do you expect that to change anytime in the near future, that we'll have patients will have access to treatments that are being explored, or possible vaccine testing?
I had a discussion earlier this week, and you may have something to add, Doctor, but I had a discussion earlier this week with Vito Intervac on where they are in their vaccine research and the partnerships that they have, international partnerships around the world, and some of the international work that they're doing, and also some of the human trials that they'll be moving into as the next phase, as they have completed their animal testing, but the human testing trials that they will move into this late summer, early fall. And where those are taking place. And they have a partnership with another company that does human trial testings, I believe, in other areas of Canada, including Saskatchewan. So there may be some of the human trials that do take part, do occur here in Saskatchewan as well. Again, this is an initiative that is being put forward by Vito Intervac, as they are one of the leading entities and researchers, and one of the leading candidates, I think, in coming to the people with a vaccine. Most assuredly, when you look at the partnerships that they have with other leading candidates around the world, and the production capacity that they now have, that has been funded in part by a joint funding agreement by the provincial and federal governments, that we are in a very good position here with Vito Intervac, with the funding that they have received in not only their vaccine research, as well as their production capacity ability that they will have as they come out of their human trial testing, hopefully with what will be a viable vaccine, one that was developed there, if not one that they may have access to from one of the other leading candidates around the world. We're hopeful that Vito is one of the leading candidates. We believe they are. I believe the federal government believes they are. This is really a step for Vito Intervac to be the center of pandemic research in Canada. Vito Intervac has done some very good work, and I think they have some very good opportunity to become that very center of pandemic research for all Canadians, and they're going to lead the way when it comes to finding a COVID-19 vaccine and producing it for all Canadians. So the human trials will take place, to my understanding, across Canada, but up to and including some Saskatchewan residents as well.
We'll take our last question from the room. Adam?
Are there any concerns about Canada Day gatherings? Typically, it's a big friend and family gathering, people at the lake, that sort of thing. What advice and, I guess, words would you have for people of Saskatchewan who would like to get together and see friends and family tomorrow?
I would just ask them to, again, the same as we did on Easter, the same as we did during Ramadan. People have made great sacrifices in this province. Just ask people to keep the public health orders in mind, to adhere to the public health recommendations that Dr. Shahab and his team have made. It's working for us. Our numbers are strong in Saskatchewan. They're strong because we've adhered to and found innovative ways to celebrate birthdays, weddings, memorials. We found innovative ways to worship in our services across this province, and I know we'll find innovative ways to gather either virtually or in person at a distance for celebrations like Canada Day. And I would just urge all to enjoy the day tomorrow. I wish them a very happy Canada Day, but I hope they do so safely. Anything to add, Doctor?
Yes.
Follow would be, you mentioned mask wearing in the fall, and I know you said in elementary school it may not be something that happens, but what about in a high school situation where teachers are moving and they're not typically going to teach just the same classroom of kids, and high school kids may be more susceptible to passing on the virus as they're a bit older?
Yeah, so so you're absolutely right. There's kind of 3 or 4 population groups: daycare, low risk, and we've already seen we haven't had any problems with daycares for the last 5 months of the pandemic, so that's very reassuring. Elementary school, again, younger children, lower risk, and more or less children and teachers remain as a cohort, and there's a little mixing. So that's, and wherever there's opportunity mixing, reducing that, like not having large assemblies and staggering play times or gym. You're right that a high school is a hybrid between elementary and university. So the post-secondary sector already is developing strategies for how to have labs and other settings where you can space students out and try to cohort as much. And naturally, students are cohorted, even if they're taking different subjects. They are cohorted in terms of who they are with in a particular lab or a class. And basic principles like trying to sit in the same place every time so that you're sitting next to the same group of people in class or lab, I think, are good principles to follow. And same would apply to high schools. There's just a bit of thought that obviously it's not feasible for them to be cohorted the same way as in elementary school, and it's not quite like the university experience. There's a greater expectation of physical attendance as it should be, but then doing that in a way that in case there is transmission, it's limited to more of a cohort in several classes and not just random mixing within the high school.
There are differences between the child care, the early years, the elementary school, the high school, and then, of course, the opportunity as we have in this, where Dr. Shahab's office and public health are working closely with our post-secondary institutes to offer some degree of in-class learning at our post-secondary institutes, and they're putting forward their guidelines that will adhere to the public health standards and give everyone the opportunity for some in-class learning this fall.
Thanks very much for joining us today, everyone. That concludes our time.